Hello, welcome to Comcast Newsmakers, bringing you news and information from people making a difference in our communities. I'm Beverly Weaver, and joining me now is State Representative Cindy Acree. Thanks for coming in.
You bet.
Let's talk a little bit about something you're very passionate about, health care reform. In Colorado and nationwide, what do you see the largest problems being right now, Representative?
I think it's access to care. We always talk about insuring everyone, even though we currently have a huge Medicaid program. We have lots of opportunities in the private sector, but if we don't remove the barriers for individuals to get insurance both in the public and private sector and provide access through a primary care system that reaches all across the state, we'll not address the problem.
This is something that we face here in Colorado, in part because we are such a urban/rural area. We really have that difference, that disparity in coverage, don't we, in certain parts of the state?
You bet, and because it's tied to employment, that is even exacerbated by the fact that we've got people losing their jobs. We make it difficult for farmers and ranchers to acquire insurance on their own. There are a lot of barriers we need to remove.
In terms of people who may have a short-term loss in coverage, that is also a critical issue as well, because you do have, as you mentioned, the people losing their jobs. They then lose their health coverage, don't they?
And they do fall into that consideration of being uninsured. So the population, when we talk about it being a huge uninsured population, if you mitigate it by the number of people who are here illegally, people who are in between jobs and don't have insurance, and those who make over $75,000 a year who could afford their own insurance, the numbers are a little bit misleading.
Yeah. In terms of what Colorado is doing and trying to do, could we really become a model for the nation in the terms of the way we're dealing with health care coverage in the state?
If we did two things, we could, I think, address health care for our state, maintain state rights, and be a model for the rest of the country. Guaranteed coverage, which is not the same as the single-payer system, nor is it guaranteed issue. We're not going to force people to issue these policies. But we want to make sure that everybody can get insurance. Remove the national restriction on individual tax deductions of health care premiums and get Congress to work with us on that. Allow individuals to purchase health insurance across state lines in other states where it might be cheaper. And we can do that here in Colorado. And develop primary care centers all over the state. Partner with nonprofit and for-profit entities to make sure we have doctors who are willing to take our Medicaid patients and raise the reimbursement for Medicaid, give people care where they live, keep the non-urgent care out of the ER. There's a lot we can do to reduce costs.
How is this different from what's being discussed on a national level? Do you feel like this is something that other states or even the national legislature and national Congress is not yet thinking about?
Other states have tried components of it. They have not worked on the delivery system. It's a system of care. We often judge things by whether they're fast, they're cheap, they're good. You can seldom have all three, but sometimes you can have one or more, one or two of them. So let's develop a healthcare system of care that gives access to everyone, that is both based on outcome medicine, good quality care as quickly as we can get it. But we've got to address care for all of our Colorado citizens.
Now, this will break out in terms of basically two issues that you're going to bring up before the next legislature. Briefly, kind of tell me how you forecast those to go, how you anticipate your support falling on that, and what kind of battle it would be to get that through the legislature.
Fortunately, I have a long history in the healthcare communities. I have already approached many healthcare organizations, hospital CEOs who already see the need to develop primary care centers out in these areas and see a huge benefit by putting public health and education and prevention right there in the midst of it. Worked with medical societies, organizations that support different healthcare initiatives, the insurers. I think we're all willing to come to the table and make this work. And I believe that we can allow the for-profit entities to make a profit, but make sure that we have a system that gives equal access to care all across the board.
Yeah. And in terms of that, where can people go to get more information, Representative Acree?
You can come to my website at cindyacree.com or call me at the Capitol. And please stay on top of colorado.gov, because you can get the first-hand information on what bills are coming to the floor and what bills are being heard in committee.
Very good. All right. State Representative Cindy Acree, thanks for being with us.
Thank you.
And thanks for watching Comcast Newsmakers. I'm Beverly Weaver.